Welcome to your orientation for your OB Experiential course. We'll be going through only OB information. The Skills Day information is forthcoming. So what we'll start with is our OB lab. This follows the same framework as the didactic course with information and videos for you to watch, as well as questions, a question and answer area for you to be able to ask questions in real time. We'll go ahead and start out with clinical. So you'll be going to the hospital for 3 days. OB is a very interesting area because you never know what your assignment is going to be. The only thing that you're absolutely guaranteed every single shift is the care of a pregnant person or a postpartum person. The newborn or seeing a delivery isn't always something that we can promise. We do endeavor to try our best to make sure everyone gets to see a delivery either by C-section or spontaneous vaginal delivery. But because we can't guarantee that, I want to go ahead and go over some clarifications around that. So each day has instructions with it, what your objectives are, the work that you have to do ahead of time, as well as what you're expected to do during clinical and after clinical, okay? Each page has that information clearly outlined. Now, the maternal newborn teaching presentation, that assignment has to be uploaded 48 hours also ahead of time so that your faculty can take a look at it before you do your presentation. You will select your topic, and the way that you do that is by going to the people page and then finding your clinical group and submitting your topic, okay? These are some examples of topics that you can select. However, if you find that there's something not on there that you would like to present on, please feel free to just notify your faculty via the people page announcement when you are requesting your topic. It is first come, first serve. And what that does is it ensures that no one duplicates any projects and that the process of topic selection is transparent. All right. Of course, we have the rubric. Make sure that you're following your rubric so that you can get all the points. A question that we normally get is, do I have to write a paper? A paper is not required for this assignment. What you're presenting and uploading is whatever teaching tool you're going to be using. Now, if you're doing a demonstration, you should have a write-up of the steps of your demonstration. And so that's what you would be uploading. Your uploads must have APA references and citations. So please make sure you review the rubric on that. You also get to select what day you go when you select your topic as well. Discussing the options, you will select to either do your maternal DocuCare assignment or your newborn key assignment on your first day, depending on where you are. So say you get assigned to postpartum, we highly recommend that you start with the newborn key assignment because you're going to have a baby to assess for that day. It's a lot easier to get your maternal DocuCare done. So this is why we say to start with the baby, newborn clinical day 2 assignment, if you have access to a baby for that day. Another important thing to note is a lot of people like to wait and not submit an assignment on the first day. We don't recommend that. And the reason is that often we identify that there are issues in Block 3 with basic documentation, SBAR, people are still being tentative with seeking opportunities and things like that. And so we want you to have the opportunity to resubmit something before your clinical is over, or if we identify that there's a real critical thinking issue or a foundational issue, we want to make sure that we're putting you in the assignments that are going to grow you there. Please do an assignment on the first day. I always like to tell people that the day 3 ends up being a gift of time as far as preparation and assignments is concerned. So again, you will choose to do either clinical day 1 maternal DocuCare or clinical day 2 newborn key assignment on your first day based on your assignment. Okay, so let's talk about your maternal DocuCare. This is graded in DocuCare, but we do bring over the information on the rubric. All of this expectation of documentation is also listed in your DocuCare assignment. Please, please, please do not start a clinical documentation assignment. So we'll go ahead and go over to Course Point so that you can see how to log into your assignment. So once in DocuCare, you will find your cohort information. You will click on it and you will select the OB Clinical Maternal DocuCare assignment. Please do not create your own clinical assignment because those don't have instructions in them. And therefore, you will not meet the expectations of the assignment because you'll just be winging it without any direction, okay? You'll also see that these will open up for simulation the morning of your simulation. Here, we're wanting to reinforce standard operating procedure for every single patient. So we want you to remember that just because it's an OB patient, that doesn't mean we're not doing a Braden scale, we're not doing fall risk, we're not doing I&O. Next, we'll look at your newborn key assignment. This assignment has 2 actual pages. You're going to open up the document. Of course, you're following your rubric, and you need to put in all of the patient's information, the mother, okay? So here is your name. Here's the example of the patient's initials, okay? And you're putting in, again, you see this right here, maternal history. You can't prioritize what you need to do with your baby by just looking at your baby. You also need to have all of this information, as well as what's listed in the labor and birth information. Next, you want to make sure that you outline any complications during delivery. And even with a normal delivery, there are risk factors, okay? So you'll want to go ahead and put your risk factors in. Next, you're going to document your assessment findings in every area for your newborn. Then you're going to go out and you're going to figure out what's the significance of this? Why is, vernix on the newborn, okay? Now we know that newborn lecture is a little bit further on, depending on where your clinicals are placed, and this is why we need you to go in and do the significance. So you must fill out everything that you see and provide the significance for that. Okay. Now the third page is asking you to think about now what you need to be aware of for that baby. So this again is all related to the baby. Following the newborn assessment, and you got your history of any risk factors for the baby, what happened in the labor, what happened in the delivery and birth, and what was going on with the mother. So make sure that you're clear on that. Okay, and all pages need to be submitted. Here is your OB medications worksheets. We broke this up because we find that some of the biggest weaknesses we have with Block 3 students is their confidence associated with medication. Your antibiotics and pain meds, we need that done as soon as possible because that is medications that you have given previously. Then you're going to have medications for your lab day. And then we have medications associated with your high-risk antepartum and labor modules. So you're breaking this up, but you're going to do the full upload of all 4 documents into this assignment, okay? The reason that we have you doing that is because we want you to clarify, to add information. We want you to bring all 4 sheets as you're completing them to every single experience. That way you're seeing the medications multiple times and you're working with the medications multiple times. We're also needing to make sure that you do not just copy and paste whatever you're finding on whatever resource you're using. That doesn't serve and that doesn't support your learning. So we want to make sure that when you are working these, you'll be working them through the OB course, but you will do your final submission for your 3rd clinical day. All right. Next, let's go ahead and talk about your OB simulation. So your OB simulation is broken up into a couple of steps. The instructions are here outlined, and one of the things that we want to especially highlight for you is what we talked about in your orientation for your didactic. When you are in the course and you are preparing for this assignment, you want to ensure that you are logged into the correct area. Okay? Please go through the course point for the text to access your vSim. Here you'll see the names of the cases that you'll be taking care of for your simulation. Olivia Jones and Fatima Sonogo. There are additional cases here for you to work with. However, those are the 2 associated with your vSim. When you click on the vSim, it's going to take you through the steps. Okay, and lo and behold, they match the steps of your assignment. Step 1 and 2. Okay, 3 is the actual VSIM itself. Step 4 and 5 for each client. Okay, and then there's a self-reflection. So you'll do your reading to prepare, and then you will do your pre-sim quiz for both cases. That will be captured in your preparation for step 1 and 2. There is also a VSIM clinical competency packet, which you can download that will help you organize yourself with the information. And here, it's absolutely follows step 1, step 2, step 3, okay? So again, this is a place for you to kind of help you work through the critical thinking associated with this simulation, all right? And even provides for you a concept map that you can prepare for your simulation. Okay. So step 1, again, do not use the VSIM independent link or your scores will not record. Complete your suggested readings and prep and complete your pre-sim quiz for both cases. Your step 3 is the actual VSIM. You're not doing that unless you want to practice. This is the sim that we're doing in person. Next, when you're done, because you'll be randomly assigned the morning of to your case, you will only complete one case which you cared for. So here is your step 4, which is your post-quiz, and then your DocuCare. All right? Your DocuCare, you're going to complete within 15 minutes of completing your simulation. We really need you to start integrating that skill of providing care and documenting. Finally, you will do a self-reflection of your experience. There is an article that you will be reading, and then some questions on the article, followed by some reflection on the simulation day. Please note that this self-reflection is expected to be substantive. So if you put 2 sentences about, question number 1, then that's not really helping us understand why this speaks to you. So you don't want to just answer the question. You want to add context to why this speaks to you and what this means and how you're going to take this forward. All right. And then here, this also is not just for your reflection, but it helps us to know, what people's emotional process was, as well as their critical thinking process. So we focus a lot on critical thinking, but we are trying to build in you that holistic experience, as well as, continuing to build your confidence and making sure that we are aware of any kind of barriers and things like that. So most of the time people come into simulation really freaked out. And by the end of it, they recognize that, this is a learning simulation. Is it possible for you to have to come back and remediate? Absolutely. Don't you want to get better? We also might send you to Open Lab to practice some skills. We may communicate with clinical instructors to provide you with additional opportunities while you're in clinical. So simulation is a really powerful tool for you to learn from, for you to make errors in, and for us to be able to provide lots of support in. All right. And so that is the overview of your OB experiences. Please be sure to add any questions into your Q&A, which will open up here once we post this video. Have a great day.